What would be the perfect diet if someone is willing to do whatever it takes to heal their body?
I get this question about the perfect diet, or more commonly, because I'm a real doctor, I see real patients. More commonly, I'll have somebody go through my live-in program, which, by the way, is a telehealth, telemedicine program now that people from all over the world take. It's called the 12-day McDougall Program. And I get a chance to take care of all kinds of people. I took care of 6,000 people in residential settings in California, both at St. Helena Hospital and at our resort in Santa Rosa. I took care of 6,000 people. And I'll tell you, some of these people are very desperate when they come, and they leave very desperate. And, often the whole program is just way too much for them because of where they came from and the little they knew. And they leave sometimes with a diagnosis of cancer all over their body, or dying of heart disease. And I'll look at them and say, you really have not done a lot as far as figuring out how to fix the food, have you? And I say, tell them this, I say, look, why don't you just eat sweet potatoes and broccoli until you figure it out? Because you can live on sweet potatoes alone, or regular potatoes alone. It gives you everything you need. So seriously, I mean, somebody as desperate as, say, dying of breast cancer, I would think that would be a good tip. And if you ask for the perfect diet, I went through an exercise one time called the optimal diet, where I eliminated various foods because they had gluten, or potatoes because they had solanine, et cetera, et cetera. And I came out with sweet potatoes and a diet of cooked green and yellow vegetables. That would be about as perfect as I think you could get.
Should we eat brown rice? Should we be concerned about reports that there's arsenic in it?
Two questions. Should we eat brown rice? I think it's preferable. We serve brown rice at our clinic, but we also served white rice at our adventure trips because it was a bit of vacation. Brown rice has some positive things over white rice. You take the coating off the brown rice, you lose some vitamins and, of course, some of the dietary fiber. But quite honestly, I just want to win the war. I don't need to win every battle. Until I tell people, look, if brown rice or white rice is the deal breaker, let's just have the white rice, okay? Because it's not a deal breaker. After all, there were once 2 billion Asians before 1980 who got 90% of their calories from white rice, and they did just fine. So, I kind of make that compromise. As far as the arsenic goes, there's a whole story about this, and you can again find it in one of my newsletters. Just enter arsenic in the search engine. A whole discussion about the arsenic in rice. You don't want to eat arsenic. But Consumers Reports, which published the article on arsenic in rice, the year before, they published another report on fruit juice, which had more arsenic in it than the rice did. I don't know why they didn't publicize that one. The way you get the arsenic in the rice is it's grown in contaminated fields. For example, a lot of the rice comes from Louisiana, where they used to raise cotton, and to kill the boll weevils, they put arsenic in the fields. That's how the arsenic got there. And so now you grow your rice on contaminated fields. What do you expect? Yeah, rice is a little bit of a hyperaccumulator, not like cruciferous vegetables are. They're real hyperaccumulators of seriously toxic metals. So what should you do? I think you should try and eat clean rice. You eat rice that wasn't grown on these contaminated fields, and there are some manufacturers who make an effort to tell you about the arsenic issue. You should not stop eating rice. Rice is a wonderful food. Clean rice is even better.
Is there a way to stop cancer from spreading if you have it and prevent it from coming back for people in remission?
Well, cancer is thought about as a runaway train. You can't stop it. And that's because in most cases, it's not stopped if it's a serious cancer. The patients go on to die of it. And it's a very serious problem, to say the least. I am absolutely certain that you can change the course of this disease. And not only am I certain, but so is the American Cancer Society, who in February of 2015, they published their position on diet and cancer and told doctors around the country, around the world, that part of the fundamental therapy for breast, colon, prostate, et cetera, cancers was to teach the patients a healthy diet because it changes the course of the disease. That's the American Cancer Society, February 15th, I think it was 14th, 2015. Anyway, yeah. Some people get breast cancer and die 40 years later. Some people die 4 months later. There's a difference in the course of the disease, and it depends upon the aggressiveness of the tumor versus the resistance of the body. And by changing the diet, you change the aggressiveness of the tumor. You don't feed it the things that keep it as poisonous as it is. And by feeding a healthy diet, you enhance your immune system. Yeah, I believe you can change the course of this disease. Absolutely. This is it's a runaway train in most doctors' offices because all they have is a bunch of useless poisonous chemicals and a bunch of surgery that doesn't get to the heart of the matter. No radiation. You've got archaic tools, ladies and gentlemen. I realize they make a huge profit, but you got archaic tools. Why don't you get back to something that really is important, like the American Cancer Society statement on a diet for your patients? Yeah. Then you'll make a difference. Then you'll feel better about going to work every day.
What should a man or woman do if a mammogram, MRI, or other diagnostic tests finds something in their body that could be malignant? Should they biopsy it? Should they remove it? Should they treat it with mainstream protocols, or should they consider alternative protocols?
That is too general a question. There are too many different answers I could give you for that. I think the first answer I'd give you is you shouldn't go looking for trouble. So I don't recommend these screening tests. I recommend maybe pap smears and women in reproductive ages, and maybe a colon cancer test. I might recommend that. But mammograms and breast self-examination and prostate exams, they're dangerous, not just useless, they're dangerous. So you shouldn't be going looking for trouble. We have modern technology. It's so modern, it's so efficient that someday nobody will be well. For example, if you do 2,000 CAT scans, you find 1,300 abnormalities that you weren't even looking for. Be careful what you ask for. But as far as various early detection tests, I've written about this in my newsletters on my website. So that's where I would go. It's amazing what you can find on my website. Free.